Welcome everyone, my name is Ashley Klein-Jimenez and I'm from Prevent Connect. And you're joining us for our web conference session today on organizing for economic opportunity, strategies to improve economic opportunities for sexual and domestic violence prevention. So glad to have you here with us. I'm really excited that while I'm not in person with our friends at Prevention Institute, that we are still here together. So I want to turn this over to our wonderful partners. And Alicia, I'm going to hand it over to you and hope that you will introduce the rest of the Prevention Institute team.
Yeah, hi everyone. This is Alicia Somji from Prevention Institute. And with us today we have Lisa Parks and Morgan. We also have Allie who's in the room. So do you all want to just say a quick hello?
Hi everyone. Hi.
Thank you. So I'd like to start off by sharing our objectives for today. If you can just, tech team, if you can give me the podium, I can advance my slides. Thank you. All right, so today we're going to be talking about factors that promote economic opportunity and can prevent sexual and domestic violence. Our guests are really going to help us talk about on-the-ground efforts to strengthen economic supports. We're also going to be identifying opportunities that make the case for sexual and domestic violence prevention as a workplace priority. So not only looking at things from an economic opportunity standpoint, but also from a how can workplaces make this an issue to be concerned about. And also, of course, as always, we like to have a lot of discussion and encourage a lot of text chatting. So we're going to have a discussion on considerations and challenges in working with employers. That will hopefully help you in your local work. So those of you who are returning, I did see quite a lot of you have been part of a Prevent Connect web conference before. This season, we've been starting off with this Thrive framework for many web conferences. And those of you who haven't seen it before, I'll give you a quick overview. Thrive is a community resilience framework and tool that helps us think about community-level prevention for a range of issues. So through this series, we've been applying it to sexual and domestic violence prevention to look at how the people, place, and opportunity environments relate to sexual and domestic violence prevention. In today's web conference, we're specifically going to look at the equitable opportunity cluster. So far, we've spent time talking about the people cluster in earlier web conferences in this series, talking about things like healthy gender norms and social networks. But today, we're going to look at how economic opportunity can protect against sexual and domestic violence, and then how workplaces can create positive environments that have positive norms and sanctions against sexual and domestic violence. So in this economic opportunity or equitable opportunity environment, we see that economic insecurity often plagues entire communities with instability and concentrated disadvantage, making it difficult for many to provide necessary resources for their families. In contrast, we see that family and community economic stability increases the ability to securely meet basic needs. This basically means that economic opportunity can support stability and address issues like poverty or low income, financial stress, and gender inequality. There are opportunities for those working in the fields of sexual and domestic violence prevention to promote economic opportunity and also create safe and inclusive workspaces. The CDC Technical Packages, the Center for Disease Control and Prevention, they've kind of outlined a bunch of recommended approaches. And here I've pulled out some of the ones that have to do with economic opportunity, such as strengthening economic supports, including work and family supports, and supporting organizational policies and climates that support safety. And this in turn relates to economic stability and can create protective environments for people to thrive. So from this technical packages from the CDC, this is based in the evidence and looking at where the evidence is and showing that these approaches can work for helping prevent violence. Now, the ones that do have to do with workplace climate, I think still do relate back to the people cluster. So while they are important for ensuring that people feel safe at their work and continue to have stability in their employment, it also relates to things like creating norms that support nonviolence, or really making sexual and domestic violence a workplace issue or a community issue, rather than something that is private and only for something to talk about within the home. So with all of that as a quick overview, I'd love to hear from all of you in the text chat right now. Please feel free to type in how economic security or insecurity is coming up in your community. Is poverty a huge issue for many folks in your community? How is that relating to things that are coming up within your community? And so while you're writing in your responses, I wanted to highlight a quick example before we get to our guests, which is the low-wage, high-risk pilot that Futures Without Violence has introduced. And it's to address the needs of low-wage workers and what they face in terms of gender-based violence and exploitation in the workplace. So this project is focused on improving environments in retail, food service, hotel, home care, and agricultural industries, where workers tend to face the greater risks and where we tend to see a lot of workers who identify as being women and those who have lower wages. And so through this pilot, Futures Without Violence has been working with employers and community organizations, advocates, and employees to introduce policies and develop best practices that promote, that protect against gender-based violence in the workplace and ensure economic security. And so to get a little bit more in depth about what that looks like, I wanted to share the example of the Coalition for Immokalee workers and their implementation of the Fair Food Program. So it's a partnership between farmers, farm workers, retail food companies that ensure humane wages and working conditions for workers who pick fruits and vegetables on participating farms. So supporting workers organizing, they're supporting workers organizing to have working conditions that are more just and equitable, and part of them is to improve wages. So companies like Walmart or Subway, McDonald's, these companies that are participating and buying tomatoes from participating farms in Florida, they're able to buy from places where workers have standards and systems to protect against trafficking, sexual harassment, child labor, and other abuses in their fields. And also part of this program, buyers are paying more per pound, and that additional funding goes towards wages for the workers. And so that kind of shows the connections a little bit between economic stability, wages, and sexual and domestic violence prevention. They've also integrated a training program for supervisors to be able to identify, respond, and prevent sexual harassment, domestic violence, stalking, etc. So I'd love to turn it back to our team at Prevention Institute and at Prevent Connect to see what's been coming up in the text chat.
Sure, Alicia. Well, this is Ashley. I can start off. So thank you, everyone, for your insights and sharing what's happening in your communities. There's a lot of talk about a real lack of affordable housing, lots of poverty, unemployment issues, folks not being able to afford mental and physical health care, and then some of the consequences that come of inability to access mental health resources. So people then turning to drug and alcohol, developing substance dependencies, and then not being able to afford treatment. So many of these things kind of break off into other issues. There was also, someone from a community college mentioned the food and housing insecurity among the students. So there were folks who are working in with specific communities who pointed to issues that were really related to those communities as well.
Thank you for sharing. Yeah, I think it really is cyclical in nature. We see places where there are low wages, also lack of affordable housing and the cycles with that, and then access to treatment, and it all kind of becomes a cycle, and becomes difficult to interrupt that cycle. But I think that looking at economic opportunity is a way to start thinking about these things, and I'd love to introduce our first guest for today, the Wyoming Coalition Against Domestic Violence and Sexual Assault, and also the Wyoming Health Council. So we have, let me just advance my slide here. So I'd like to introduce Jody Sanborn, who is a prevention specialist with the Wyoming Coalition Against Domestic Violence and Sexual Assault. Jody leads the rape prevention and education efforts in Wyoming by collaborating with communities for social change and co-facilitating the Wyoming Sexual Violence Prevention Council. She has experience at a national, state, and local trainer level, specializing in rural community education, organizing and mobilization, and college populations. She is very passionate about collective impact and evaluation for social change, and she's going to share a little bit about that today. We also have Dr. Susie Marcus, who is the Executive Director of the Wyoming Health Council, a nonprofit agency established in 1990 to serve as Wyoming's federal grantee for the Title X Family Planning Program through the U.S. Department of Health and Human Services. Susie has a PhD in educational leadership, a master's in counseling, and a bachelor's in social work. So Jody, Susie, and their teams are in the beginning phases of developing a collective impact model to address the gender wage gap in Wyoming. So hi, Jody and Susie. Can you start off by telling us how this kind of got started and how you started focusing on the gender wage gap?
Yes. Okay, this is Susie, and I am going to talk about how this got started. There were 4 opportunities that merged to start our collective impact initiative to address the wage gap in Wyoming. And first, the Wyoming Health Council was invited in 2007 to join the Wyoming Coalition Against Domestic Violence and Sexual Assault strategic planning process to develop a meaningful initiative for implementation of the CDC's RPE program. And so with numerous state and local partners and a comprehensive needs assessment, we developed an initiative for the primary prevention of sexual violence against 12 to 24-year-olds in Wyoming, which has now been funding and supporting the work of pilot communities throughout Wyoming since 2009. The Health Council provided community readiness assessments and workshops to measure, facilitate, and track communities' readiness and progress in collectively engaging in primary prevention in the RPE for several years. We would provide the initial community readiness assessment, and then Jody would provide intensive TA for the communities. And then we would follow up with a community readiness assessment to track progress in each pilot community. Then in about 2014, Jody and the State of Wyoming Department of Health introduced collective impact to our initiative. And when Jody learned about collective impact, she recognized that collective impact could be an overarching structure and encompass all of our RPE work. Then the next thing that happened was in the fall of 2016, I was being interviewed by a Cheyenne news reporter on the decline in teen pregnancies in Wyoming. And we know, working in Title X, that in any discussion about teen pregnancy, we really have to discuss vulnerable populations and risk and protective factors. And so this automatically leads to a discussion of Wyoming Health Council's family planning work under theories of social justice and accomplishing our work through identifying and addressing social determinants of health. So this piqued the reporter's interest, and she interjected that she was working on a larger story about the gender wage gap in Wyoming, and she asked if I would be interviewed for this story and provide her with others who might be willing to be interviewed, and I referred her to the coalition. Then in the fall of 2016, a Wyoming legislator was quoted in the Wyoming News as stating that women create their own wage gap because we are most likely to use all of our leave at work and to miss work for our children's activities and illnesses, and thus we drive up costs of our employers' organizations.
Wow.
Yeah. In the fall of 2016, the coalition contacted me at the Health Council and invited us to start identifying an issue to participate in a collective impact initiative. And then I mentioned the newspaper's focus on the wage gap, and we all discussed this legislator's comments. And we agreed that just as we were heading into legislative session for 2017, it would be the perfect combination of people, place, events, and opportunities to focus on Wyoming's gender wage gap.
Great. I think that's a great introduction to all of this. Can you share a little bit more about the context in Wyoming with the wage gap and frame the issue a little more for us?
Yes. So as you can probably guess, Wyoming is a socially and politically conservative state combined with rural and frontier geographic weather challenges. It starts snowing here in October, sometimes September, and sometimes it doesn't end until May or June. And then it can take, anywhere from 3 to 6 hours to drive between towns. And 18 of 23 Wyoming communities are designated health provider shortage areas, and all of Wyoming is a designated mental health provider shortage area. So we also have strong male gender norms and a strong independent spirit, and it's encompassed by, you can hear this everywhere in Wyoming, cowboy up and pull yourself up by your bootstraps. We have an almost all-male legislature, and it's almost all conservative. We have the highest gender wage gap in all of the United States and the District of Columbia. Here in Wyoming, women earn 64 cents for every dollar earned by a male. Dr. Catherine Connolly is a University of Wyoming professor, and she's also a Wyoming legislator. And she worked with the Wyoming Women's Foundation in April of 2016 to publish a report on the gender wage gap. And because of her work, as well as the work of the Wyoming Women's Foundation and the Wyoming Coalition, we know that if we continue with current processes, we won't close the wage gap until 2051. So more about the context in Wyoming. This slide shows us that there are even gaps when broken down by different social determinants. For example, men with a high school diploma still earn more than women with a bachelor's degree, and men with a bachelor's degree still earn more than a woman with a graduate degree, and I can attest to that in my own family. And then, so I think that's all I need to say about that.
Great. Can we move to the next slide, please? Web text.
All right. So we are lacking recognition of the systemic issue in Wyoming. There's a lack of understanding and willingness to try to understand that the wage gap is a systemic issue. We had another legislator, so this is a different legislator, who stated that the pay gap is simply a fact of life and, again, puts the responsibility on women and our choices. So you can see how this mindset sort of permeates our state. It demonstrates a lack of community readiness at the stages of no awareness to denial and resistance that we have documented in our RPE work. But yet in our RPA work, we have demonstrated that through reducing Wyoming's isolation, by fostering community connectedness to collectively identify and address the issues, we are really able to break through denial and resistance and bring together people from all walks of life and professions to work together toward change at the community, institutional, and policy level.
Great. I think that really frames the issue for us, and it's interesting to see how there's a lack of recognition that the issue is systemic, and it's being seen more as a issue of choice. So I'd like to turn it to another text chat question and ask our audience, how do you make the case that economic security is an issue and also an issue that's related to sexual and domestic violence prevention? And with that, how are you starting to promote opportunity in your work? I know that this is a big question for all of you, and it kind of has two parts to it. So I want to give you time to answer that. And while you are all text chatting, I'd like to turn it back to Jody and Susie to see, or I guess Jody, being part of a coalition against domestic and sexual violence, why did you decide to take on this issue, and how do you make the case to others that wage gaps matter for prevention?
Sure. So good morning or afternoon, everyone. This is Jody. At the coalition, being a really strong social justice, primary prevention-based organization, we've always been very cognizant about the fact that we have to address all of our work from a shared risk and protective factor lens if we are going to truly see social change and reductions in domestic violence, sexual assault, et cetera, in Wyoming. And so as we've always worked from that approach, we just took that same step with doing this work. So we've really been communicating with our potential partners and our partners about how that works and what that looks like. And for some people, that takes a little bit more information sharing and education and getting people really on that same level playing field to be able to address this work from a shared risk and protective factor lens. So on this slide, you can see here there's a photo of a training that we conducted that was for all of the executive directors of our local domestic violence and sexual assault programs, as well as potential partners, when we were very first introducing this idea that we wanted to do a collective impact initiative that was really looking at reductions in the gender wage gap. So through this, also really heavily relied upon some of the assistance that we've had come out from the Centers for Disease Control and Prevention at the CDC. In the last couple of years, they've released technical packages that help provide direction around how to increase economic opportunities and supports for women and girls, and really laying it out there that, again, back to that shared risk and protective factor piece, that by improving economic supports for women and their families, such as comparable salaries or just income generating options, or having things like child care services or health insurance, that those things are going to really help us all across the board, whether we are with the coalition for doing the work against domestic violence and sexual assault, or Susie at the Health Council and unintended pregnancies, or if we're looking at how the Department of Family Services can be involved, like really relying on some of the guidance that we had from those technical packages to provide us with that, here's what we know from research kind of approach to support us as well.
Great. So I'd like to turn it back to pull out some themes from the text chat and see how others are making the case for the connection and what they're doing in their work. Ashley, would you like to start off?
Sure, Alicia. So I think someone earlier, our first question, I think it was Katie, started to get to that and made the comment that, one of the risk factors of child sexual abuse is a lack of parental supervision. And when you have parents who are really struggling to afford basic necessities, that might mean that they're working multiple jobs, they're working far away, and so they're not able to do that. So that's one way to make that connection. That was an example. Some other things, Emily brought up that, the wage gap really plays into this larger systemic issue of women being valued less in society. And so how does that further economic disempowerment? Folks also were making the connection between how this plays out when violence is already happening. So, the limitations of being able to make choices and have other options when you are struggling economically. Those are some of the things that I saw come up.
Yeah. Something that's standing out for me is how folks are talking about the impact on children and how financial security or economic security and stability relates to time that people can spend with their children, and how that cycle relates to their children's relationships and their future relationships and that type of thing. Sorry, I'm not not speaking so well today. But yeah, I think that part is also interesting to think about. So I'd like to turn it back to Susie and Jody to hear more about your collective impact model. You've mentioned it already, and I know you've gotten commitment from a range of partners. So I would love to hear from you how you're organizing around this issue of the gender wage gap.
Sure. So as Susie mentioned, we've been focusing a lot of our work in Wyoming that's coming out of the Wyoming Coalition around this collective impact model. And it's a really great model for collaboration is what it boils down to, because it outlines basically 5 phases or steps that we can follow that help us break down those silos that we traditionally work in and really look at how can we have mutually reinforcing activities that will help us reach a common agenda and work together instead of in competition with each other or against each other for the same group of people, the same pot of money, et cetera, et cetera. And so when we utilize this method, it's really allowed us to see that we can work better together instead of doing lots of really hard work at the same time as other people doing lots of really hard work, but we're still kind of trying to address the same thing, if that makes sense. Basically, collective impact allows us to broaden the net that we throw out there when we do our work beyond just the same old people always doing the same work but in competition with each other for a lot of the shared resources. So I'm trying to advance my slide. One second here. There we go. So here in Wyoming, we started off with a really core group of people who we called together because we knew, again, we were the same old people, right, that were doing this work. So we were like, I think we should do this. But if we're doing true collective impact-based work, we need to broaden that net. And so we reached out to lots of different individuals. I just learned yesterday at another meeting that we currently have around 40 individuals from different agencies and organizations or just concerned citizens in the state of Wyoming who are wanting to work with us in this effort. So we have people, like this list shows, kind of the same old people doing the work. But then, it extends beyond that. So we're doing a lot of really good work reaching out to these people and trying to get their engagement, because we know that everyone brings different assets to the table. We at the Wyoming Coalition Against Domestic Violence and Sexual Assault, we have a pretty broad, narrow focus, if that makes sense. But we know that people at Climb Wyoming, which is an organization that specifically works with women who do not have necessarily a high school degree, but it gets them job training and gets them out into the workforce service, they have a lot to offer specifically to this issue. So we, of course, want to partner with them and bring them in. So the other thing that's really great about having a really broad net when we do this work is it allows us to really have different advocacy at lots of different levels of the social ecological model going on as we're doing, developing strategies and doing the work. So we have the people who are doing the work on the ground with individuals in communities all the way up through policy advocacy and media advocacy. having a state legislator who is also a professor and does research on this topic has been absolutely instrumental in bringing this issue to the forefront and getting policy support for addressing this issue at that level. So we're continuing to expand our partnerships with other people and train those folks about shared risk and protective factors and primary prevention, and really just connect the dots across the board.
Wow. And it seems like you already have quite a lot of partners part of this, and really built up some strength with that. How did you get to the point of having such a strong group of advocates? And also, I know you've been doing some network analysis work, and would love if you can share about that.
Yeah, sure. So I think I kind of already addressed, I was jumping ahead a little bit, how we really pulled together this strong group of advocates. But one of the core components to collective impact is just continuous communication. And that can only happen when, we're working constantly on building trust and relationships with these partners. We know that any sort of collaborative initiative that's going to be successful has to be rooted in trust. Because if we don't trust the other organization to do good work or to be a part of it, we're not going to be willing to share resources and strategies, et cetera, et cetera. So we really make sure that we have continuous communication with all of these people, whether we're engaging them through a email newsletter that we've been putting together that's just kind of informing folks of where we currently are in our initiative, to actually inviting people to be a part of a steering committee to help really guide more strategic direction for this group, or just sharing resources. But to get there, we also had to look at what's the current climate like in Wyoming when it comes to working together in resources. So one of the things that we're currently right in the middle of doing is a network analysis. And network analyses are so cool because it literally provides you with a visual of how people are connected through the work that they're doing. And so it starts off with data that we go through and we code and we put it in, and it projects this really cool picture, kind of like what you see on the slide here. But what it does is it shows you the different relationships that exist, whether that's through relationships for resources that people might be able to offer, or if it's relationships just through, hey, we've had some email communications, or relationships and efforts that exist that are more formalized, such as the Wyoming Health Council doing a full report on the state of the gender wage gap in Wyoming. So we're right in the middle of doing this network analysis that really continues to help build that relationship and strategic direction. So that's one thing that we're really excited about for helping to kind of guide our work at the baseline level right now.
That is really exciting, and I think that we'd all be interested in seeing your network analysis once it's done.
Absolutely.
And the next thing I want to ask you about is with regard to challenges, because, some of the work that is less macro than this is more confined and maybe a little easier to implement. And so I know you're still in the early stages of addressing the gender wage gap in Wyoming, but want to hear from you what challenges you're facing in this.
All right, so this is Susie again, and I think I've already pretty clearly painted the picture of our political climate in Wyoming, and so that is a big challenge. And then, our community norms are really, I think, not only that, that pull yourself up by your bootstraps and cowboy and cowgirl up, but and really focusing on that strong, independent spirit, but really buying into shaming and blaming our most vulnerable populations for all of their challenges. And so really what we're trying to work on is to move out of that individual focus and into fostering connectedness in our communities and in our state, to take the focus and the load off of the shoulders of the very people that are experiencing these challenges, and work with them and on behalf of our people to identify and strengthen their social determinants of health and equity. And so really, as we look at engagement, this is one thing that is two-sided in Wyoming. Sometimes engagement can be difficult because of our political climate and our community norms and that isolation. But on the other hand, it's a little bit easier because there are so few people and we all tend to know each other. And so it's really easy to engage and know people all across the state from our work. And so we really, U.S. Senator Alan Simpson once said that Wyoming is a really small town with a really big town with really long streets. And that is kind of how the whole state of Wyoming is. We all know each other one way or another. So engaging is both a challenge, but also our ruralness really helps us to connect. And with the initial buy-in, I think we're making progress, and I really think we're building on, some of our RPE work together and just the work of all of our communities in our RPE work, as well as really just connecting with everybody. And I can't say enough about the importance of connectedness in our buy-in, and how that, I think, is really at the base of collective impact. And so we have a lot of hope, too.
Yeah. I think we're all excited to see where your work goes next. We do have a question from the audience. Rachel is wondering what program you're using for the network analysis.
So right now we are still just gathering data from our partners, and so once that is done, we'll plug it into a network analysis generator. And what's cool about that is there are a lot of free programs that you can find online. The one that we'll be utilizing, I can't remember the program name off the top of my head, but it is specific for non-governmental organizations or NGOs doing this work, and it was originally developed, I think, out of a program in South Africa in the mid-2000s. So I'd be happy to share that information if Rachel wants to send me a private message with her email. I can share that resource.
Perfect. So speaking about next steps, would love to hear more about where things are going next with your efforts and getting Wyoming to close the gender wage gap.
Sure. So we're really excited. This is where, so I'm one of those people that gets really excited when things are like new and shiny, and I get, my colleagues always tell me that I have jazz hands, so I'm going to get super jazz handsy on you guys right now, or on you all right now. But we're really excited because, again, continuing to look at shared risk and protective factor work, but in being super strategic, wanting to make sure that we're doing it all accurately as we go through, we are really excited that we are working with the CDC to receive some technical assistance, and Ashley from CDC is actually on the call today, so just a shout out to Ashley, who we will be working with. But basically, it's great to have that level of support because we know that our strategic process and direction will be, just really where it needs to be for that. So how we're going to be doing that is we'll be having an in-person meeting of our initiative group in September where Ashley from CDC comes to visit us, and we began to really dive in deep. We'll be looking at all of our data that we have available, using the social network analysis that we'll be doing, as well as looking at all of the reports that have been made available in the state of Wyoming, specifically that report that was published by Kathy Connolly last year. But what that's going to allow us to do is really look at which factors or mechanisms are creating the wage gap in Wyoming, and to identify which of those are the strongest. And so once we have those identified, then we can go in and develop short-term, intermediate, and long-term strategies around those specific mechanisms that are appropriate for each of the different partners that are a part of our initiative. So that, again, it's really shared, it's rooted in collective impact, and it's allowing us to continue to do the work that we each do at our own agencies and organizations very well, but to do it with that strategic framework of this is really helping us look at, a strategy that's going to be hopefully contributing to closing that gender wage gap. And so by doing it in that way, and also just knowing all along that we're being strategic, developing a specific evaluation plan, looking at really cool things like logic models to guide our work, and also like really big cool evaluation things like interrupted time series analyses and fun things like that if you're a data nerd like me, you totally get excited about. So I guess the big picture message here is that we're being strategic as we're moving forward, and we are very grateful for the assistance that we are receiving from the CDC through this process.
Well, we look forward to following up with you and seeing where things go with this work. We had someone in the text chat share a really nice quote that I think is a good way to close out this chapter of our web conference as we move into our next guest, which is, "It is easier to accept change if you feel like you've been part of it." And I think that Emily said that this works well. This is important for norms challenging work, and I think norms changing work, and really speaks to the importance of collective impact. So thank you, Susie and Jody. We'll be coming back to you at the end of our web conference. But I'd now like to switch gears. So Susie and Jody shared a lot about things from the economic opportunity standpoint and economic security and how that relates with the gender wage gap in Wyoming. But I want to now take us back to the technical package, which also talks about organizational policies and workplace climate, and how these can create protective environments that promote safety and encourage help-seeking behavior. So workplace approaches can aid employees and managers in raising awareness about intimate partner violence and demonstrate a commitment to workplace safety, which in turn can help change the norms within workplaces and, again, make it a community level or workplace issue. And so these are some of the outcomes that are outlined in the technical package that relate to these types of strategies, such as normalizing help-seeking, increasing feelings of safety, positive changes in workplace climate, and you can refer to the technical package for more information about that. And so to speak about workplace policies and the work that's happening in that world, we have Dr. Patricia Cluse, who is a licensed psychologist with a specialty in health psychology and a long-term interest in partner violence. She recently retired from the psychiatric faculty at the University of Pittsburgh School of Medicine. While at Pitt, she developed and implemented an award-winning training on partner violence as a mental health concern. She is an author of over 30 published manuscripts on these topics. Currently, Dr. Cluse is a psychotherapist in private practice, a consultant in women's health for a regional health insurer, and the director of standing firm, The Business Case to End Partner Violence. So Pat, I know you've been doing a bunch of work on building a business case for why companies should care about domestic violence. Can you give us a quick overview of this work?
Sure, I'm happy to, and thanks so much for inviting me to be here today with all of you. Standing Firm is an organization that's been around since about early 2009, and you see our mission there in front of you. We have two parts to our mission. First, it is to alert employers to the financial, safety, and human costs of what we call partner violence on the workplace and workforce, and then to equip them with tools for taking effective organizational action. So both of those things. We make a case that the employers have a very important role to play in the community's response to the problem of partner violence. And those are the 3 R's, recognize, respond, and refer. employers can recognize that partner violence is a business issue that affects both the productivity of their workforce and the security of their workplaces. We help them understand that they have the capacity to respond in the workplace, doing things that in the workplace can affect and ameliorate some of the effects of partner violence, and we're very clear with them about the things that word appropriate is important, things they can and should be doing as employers and things that they shouldn't be trying to do. And the third R is to refer. We make sure employers that are part of Standing Firm know about the existing expert resources in the community for their employees who may be either victims or perpetrators of partner violence. So the question that is always asked is, well, really, is partner violence your business at work? And I'll be happy to talk a little more about that. One of the things that we do make an emphasis on is that if you're an employer and if you have both men and women working for you, you almost certainly have both victims and perpetrators of partner abuse. So we're one of the organizations that focuses actually on both parts of that concern in the community.
It's very important. And I think most of us in this web conference today can understand conceptually that there is a business case to be made, but not all of us have as much experience as you do in truly making it. So how do you make the case? How do you make the issue resonate with employers?
Well, we worked very hard and have learned since 2009 ways to do this. And one of the important things is helping them, particularly the CEOs and corporate leadership, make a context shift. And that's one of the reasons you'll notice I've been using the term partner violence instead of domestic violence. We decided early on to call it partner violence or PV, because when you use the word domestic, it sort of reinforces the idea that's already in people's heads that this issue is something just happens at home, it stays at home, it doesn't really have anything to do with me as the CEO of this company or as the executive director of this agency. So we call it partner violence from the get-go, and that seems to make a difference. And so we know that when men and women, partner violence victims and perpetrators are employed, that problem doesn't stay at home. It walks in the door at work, as this slide illustrates. We make the case with employers that there is an impact in the workplace and that that's happening whether they are aware of it or not. There are robust national data, and we have data from our region that makes it very clear that when employees are involved in violent relationships at home, staff performance and productivity is affected. There's an increase in staff turnover, increased absenteeism, and what's called presenteeism, which is when somebody is actually at work but distracted because of what's going on at home. There are clear effects, both acute and chronic, on employee health, effects on staff morale, and significant financial costs, particularly for medical care, mental health services, missed work days, and also if there is a workplace violence event that's related to partner violence, huge financial costs for dealing with the aftermath of an event like that. I want to say also, I've been talking about victims and perpetrators, and I do want to be clear. I guess this audience, I don't have to make this case, but when I talk, I use the pronoun she typically for victims and the pronoun he for perpetrators, but I imagine everyone in the audience knows that that the genders of those two things can be reversed. We also talk a lot in the workplace about bystanders, and in this case at work, bystanders are employees who are not themselves victims or perpetrators, but who know that something is going on with one of their coworkers. And there are very clear data that bystanders themselves can be affected at work. It's distracting. There may be reduced productivity in that way because they're concerned about a victim or someone they think might be a perpetrator. They've overheard an awful, threatening phone call that a coworker has made. And you can see some of the statistics on this slide that we gathered in southwestern Pennsylvania. It can be very uncomfortable for bystanders because, first of all, they may feel they have to cover work assignments for their friends so their friends don't get in trouble, or be uncertain about how to address that, either with their coworker or whether to tell their supervisor. And it can certainly be very realistically scary because they may be aware that there's a risk to the workplace when there's a partner violence situation going on with another employee. And you can read this slide. These are some of the statistics, of which there are many, about the direct impact of partner violence on the workplace. You can see it results in large numbers of performance difficulties, which is understandable when you are aware of the dynamics of partner violence. As it turns out, about 25% of workplace violence events in this country every year are related to partner violence. So it's not a disgruntled employee coming in or some other sort of community criminal, but it's the estranged partner of somebody who works there coming in trying to find them. And of course, in those cases, it's not just the victim that's at risk, but everybody in the workplace. And we also have, and you can go to our website, which will be on the screen in a minute, a cost calculator that we have kindly been allowed to use by an organization in Texas that originally developed it to really make the case in dollars. If an employer can go into this cost calculator, type in the number of employees they have, the percent of their workforce that's female, and an estimate of the average hourly wage, and it will calculate for them the amount of money that they are spending, whether they know it or not, related to partner violence.
Thanks, Pat. I think you're really illustrating how partner violence affects everyone in a workplace. And it seems like you really learned a lot about what resonates with this audience around framing, and even little things like not calling it domestic violence, but partner violence, to make it seem more relevant to the audience that you're trying to reach, which is employers in this case. So after you make the case, what are you asking employers to do?
And that's a very important question. We don't want them to just understand this and do nothing. We want to understand it and take action. So we help them be proactive. We help them figure out how to get organized, how to develop a plan, and to be prepared if and when something does happen, either a personnel issue or a workplace safety threat, that everyone involved knows what to do and how to do that quickly. We ask employers to become members of Standing Firm. We have both a free basic option and a paid option that provides additional resources, and the cost is based on the size of the organization. We provide a free phone consultation to new members that helps them figure out within their organization what action steps they might want to take. We have at this point about 350 employers, mostly in southwestern Pennsylvania at this point, but also elsewhere, who are members. We have large trucking companies, financial organizations, law firms, both our greater regional Chamber of Commerce and our local African American Chamber of Commerce, large healthcare organizations, government organizations, really across the spectrum of workplace types of organizations. And we have some influential thought leaders at this point, like our mayor of Pittsburgh, our county executive, and other corporate leaders.
Wow. Sounds like you've gotten quite a lot of engagement and buy-in. Can you give us some examples of policy templates, trainings, communications that you found to work with employers?
Sure. We have on our website, once a company joins, they have access to two versions of policy templates. One that's provided by the Corporate Alliance Against Partner Violence, which is a national umbrella organization working on this issue with employers, And also one of our earliest and still by far our largest member, which is a University of Pittsburgh related medical center. They have about, I think, 65,000 employees at last count. And they developed a very comprehensive policy that they have allowed us to make available in a Word document that employer members can scoop up and edit, based on what makes sense to them in their workplace, put their logo on it, and have a very comprehensive policy. We also do paid consultation to help companies develop policy if they want us to do that. We have several levels of training for general line staff, which is kind of Partner Violence 101 and how that affects work and what you can do, what your resources are if you're a victim or a perpetrator or a coworker bystander. We have specialty trainings for managers and supervisors, which adds in the information about what their responsibilities are as an agent of their organization and what they should do and what they should not do in that role. We have HR, human resources specialist training to talk with HR folks about the specialized kinds of things they need to think about. And we have leadership engagement training, which is, when we get in the door to talk with CEOs and VPs of human resources to kind of make the initial case with them. We also do non-emergency problem-based consultation. So we encourage companies, if they think somebody's on their way to the workplace, they shouldn't call standing firm, they should call the police. But when there's a situation that a company's become aware of and want some help thinking about how to manage that, we work with them on that. And we also have various versions of bathroom stall posters. I think we have one. Here's one of them that is appropriate for any either gender-based or unisex bathroom posters that talks in general about what a healthy partnership is and gives local resources. And we have other versions of that as well that are available on our website.
Great. I think it's easy for us to see the connections to intervention, but I wanted to just draw some connections for us to how these can support prevention too. I think even just changing the way workplaces see this issue and creating these community sanctions against partner violence and being able to create workplace climates and norms that don't support violence can in turn support prevention as well. And when people have these types of supports in place, they're more likely to be able to stay at their jobs and have economic security, which I think really relates both to the economic, equitable opportunity and also the sociocultural environment that I had shown earlier with regard to the norms and creating these cultures within workplaces. So I think that this type of work really supports prevention and intervention.
And I certainly agree with that.
Yeah. Pardon me?
Go ahead. No, I was just saying I really agree with what you just said.
Oh, good. Yeah, the next thing I wanted to find out was, I know we've talked a lot about engaging employers, but just wondering who else you've found to be important groups to consider in this type of work.
Sure. Unions is a large type of organization to focus on, and in fact, Futures Without Violence and their Workplaces Respond program have done a lot of excellent work with unions who, of course, work within organizations, but also have the health and well-being of workers involved. And there's, many things that unions can do to help make this an issue that is discussed routinely as part of workplace considerations, and that gets to both the prevention and intervention part. And also people at higher risk for partner violence. And this slide just shows who is at higher risk. And again, the audience today may be aware of all of these. Certainly the biggest risk factor is if you're a woman. So organizations that have a high percentage of female workers, like healthcare organizations, for example, who typically are 75% women in their workforce, are particularly at risk. Retail organizations, if you're young, you're especially at risk. Certainly if you are pregnant, this is the time during pregnancy when Violence may start if it never existed before in a relationship, and if it has existed, it tends to escalate during a pregnancy. And women with disabilities are at significantly increased risk. And the LGBTQ community is also very important to attend to, and we link locally with a large organization named PERSAD that has a long history of working with LGBTQ folks in our community, and on our website we have resources and information specifically for people in same-sex relationships, because we know that partner abuse and violence happen at about the same rates in homosexual couples as they do in heterosexual, and in fact it may be more hidden for various reasons, particularly in the workplace. And of course the following groups are more at risk for becoming abusers: if you're male, and if the person has experienced or witnessed family abuse as a child, whether or not, if they've certainly experienced it, but even we know now, having witnessed that in your family makes you more at risk for responding as an adult in abusive and violent ways in your adult relationships.
This whole idea of partner violence as an equal opportunity problem really resonates for me, because, a lot of employers say that they support equal opportunity, and I think it's interesting to see how you've overlaid this with partner violence, and I think that probably resonates well with employers as well. So I do want to turn it over to a text chat question. If we can go to the next slide. Great. So I'd like to ask our audience again, what challenges have you experienced in working with employers, or maybe even barriers to being able to work with them? And also, I know that Pat has a ton of expertise, and so if you have any questions that you'd like us to pose to Pat about engaging employers, we can do that as well. And while you're writing, Pat, if you can please share with us what challenges that you've been facing and how you're kind of working on overcoming those.
Sure. And you can see some of those on the slide. I mean, our biggest challenge, which actually, as it turned out, did not turn out to be as hard as I thought it would be, is for CEOs and other leaders of employers, of companies, making the change from seeing it as a relevant personal issue to something that they see as having a role to play in their organizational leadership role. I have had many CEOs say, "Oh, I know domestic violence is terrible. I write a big check to my local shelter every year," etc. So they recognize it as an issue in society, but they really don't understand that it's right under their noses and they're not seeing it. So that has been a challenge. But frankly, most times when we go in with the statistics and the context changing kind of conversation we have, within about 10 minutes they say, "Oh, I never really thought about it that way," or "Actually, we did have an incident last year. I wasn't thinking about it in that context." So the other challenge is helping companies figure out, once they say, "Well, gee, I guess we better do something about this," how to fit it into some already existing strategic initiative that they're already working on, so that they're not trying to add something else for people to do, but fit this in seamlessly with some other key initiative like workplace safety, for example. And that seems to make it happen more easily and tend to be maintained longer. And then the other thing is just persistence. This sometimes takes a long time. We just had one organization we've been working with at various levels and various people for 3 years, and have not been able to get them to join or on board. And they got a new senior leader in their legal counsel office, and we got in to talk with him, and lo and behold, they joined, and they're scheduling trainings, et cetera. So to just stick with it, starting at the top. If you can get in the door with the CEO or the VP of Human Resources, that seems to make it work much more easily. They will hand it off to someone else to, do the nuts and bolts of it. But when you start at the top, it tends to happen more easily.
Great. So I think that some of your comments right now probably address a little bit about what's coming up in the text chat. but one that kind of relates to this whole starting on top thing. We had someone ask, how do you work with or attempt to engage with organizations where the structure or senior management team is in itself abusive or hostile? I don't know if this is something you've come across in your work, Pat, but do you have any recommendations for those who are facing that type of challenge?
Yeah, that's an interesting question, because certainly I never know we never know when we're talking to somebody what goes on in their own personal relationships. Interestingly, that there certainly have been times when I thought to myself, that's interesting, kind of some of the comments I've gotten back. Often when you can just, again, address this as a business issue, somebody who has those kind of abusive values in their personal relationship can sometimes look beyond that when you present the facts and figures about where this is costing them money, when this is an issue for your employees. It's a wise business practice to address this. Sometimes that makes a difference. The other strategy is to just go talk to somebody else. Like I said, in the southwestern Pennsylvania region, we have 350 members, but there's thousands more companies to go to that, so we do our best when we have a conversation with somebody, but if we hit, a brick wall, which frankly does not happen too often, but when we do, we'll look for somebody else in the company who's in a leadership position. We'll go talk to some other company. And, in southwestern Pennsylvania, it's actually now kind of a cool thing to belong to Standing Firm and to be one of the speakers at at our annual luncheon, et cetera. So that kind of peer pressure as momentum builds also can change the minds of people who initially just think it's not worth the time to think about this.
That's interesting, peer pressure in a positive sense. Something else that's coming up is, I'm going to group these two questions together. One with regard to, so someone said, we come and do lunch and learns for employers about child sexual abuse, and their biggest fear is how employees will react to the topic. That is very taboo, especially here in Utah. And then the other one that I'm hoping to group with this is another problem that came up is human resource professionals only want to refer to services without dealing with problems in the office or changing, I guess, the workplace climate. I'm not sure if that relates again with the taboo-ness, but maybe there's a way to tie those two together.
Yeah, and I think taboo is a good word. One of the major messages we give to companies is that if you're not talking about this as a company, then this stuff is happening under wraps, and you have no way as a company of addressing that as a business issue if you choose to do that. So we, for example, on the first question, we recommend that companies don't do lunch and learns for line employees until they have trained their managers and supervisors, because you don't want somebody to attend a lunch and learn and say, oh my goodness, that's happening to me, and then go to their manager, and their manager not knowing what to do. We always, the person who does our trainings is an EAP professional, and she often gets people who come up after a training to talk about some personal issue. And we also make the case, likewise, for human resources folks, we make this to senior management. If you have a human resources department and your people aren't trained, and employees start coming to you as a result of communications you're giving them, you want to make sure that those people know what are appropriate things and what are not appropriate things to do. Having community resource lists available is important, but we specifically talk about the kinds of accommodations, for example, that we call it a menu of accommodations. So it literally is a menu. These are all kinds of things that companies can do to help employees who are in trouble. We say you would have to choose based on your understanding of what your company capacity is, which ones would make sense for you. So we try to do our best to help organizations understand this isn't just about giving educational information to your line staff, but making sure that your managers and supervisors and HR professionals are competent to do a good and safe job when employees do start to come to you.
Thanks, Pat. I think that we all really appreciate you sharing all of these challenges and ways that you're working to overcome them in your work. So I want to start closing things off and get us to next steps and tips. So Pat, if you could maybe answer two questions at once, one of where do you want to go next in this work, and then what tips you want to share for others who are wanting to engage in this work.
Sure. So we are, as I said, we have up till now focused primarily on southwestern Pennsylvania, but we are at the point where we're looking to develop the capacity to make this, available to anyone, anywhere who is interested. So we're in the process of, we have a staff level and actually two, a staff level and then a managers and supervisors level training available as web-based trainings. We hope to develop, we haven't yet, but to develop a webinar capacity so that companies, both nationally who work at a distance from us, can provide this training, best practices training for their managers and for their staff, but also even locally. Many companies can't bring their whole staff together at one time in one room to do in-person training. So to make it more available to particularly larger companies who would prefer to have this information available to their supervisors and their employees, but to do that in a web-based way. So that's our next steps. And as far as tips, let me put the next slide up. Really just summarizing what I've talked about, and I probably put the second bullet first. Start at the top. Find somebody who knows the CEO and get that person to make an introduction and get in the door for a half an hour conversation with the CEO or the Senior VP of Human Resources. At that meeting, present the business case and, work hard, which we have done, to distinguish this service as something related to but distinct from all the, social experts, social service agencies you have in the community. We found to get in the door at business, you have to look like a business and, bring social service resources in later. But, again, that context shift from this is just a personal community issue to this is something that I need to address in my business. And then one of our colleagues, I think, coined this phrase, build in, not bolt on. Help them figure out how to insert a focus on partner volumes into some current strategic initiative that they're already devoting resources to. And that will make it much more likely that it will happen, that it will continue, and that it will be maintained over time.
Great. And Jody and Susie, I'd like to bring you back and hear from you your tips or key takeaways from the work you're doing in Wyoming and what you've learned.
Sure. So in Wyoming, like I mentioned before, with any sort of collective impact effort, even if you don't formally follow that model, if you're just trying to find a way to work together, the key thing there is that we really want to take opportunities to build and nurture relationships. That is so important. We can't do this work without that trust. And so that is a key piece of doing any sort of collaborative work as we're moving forward. Also, the other thing is that data are your friend. We always say this. We practice what we preach, or we are trying to in Wyoming when we say that. But really looking at, strategies and the methods that you can have to obtain those data as you're doing the work, and really using that to inform you strategically, that's really what's going to get us to outcomes. And so, just identifying your own capacity or the collaborative work that you're doing, that collaborative initiative's capacity to interpret and translate data is important. So we definitely encourage that. we're really looking at what are those shared risk and protective factors and developing our strategies around that. And then also just utilizing that to help make the case for the work that you're doing, tying it back specifically to how, you know, to quote the CDC, it's all connected. And so taking that time to have those meaningful conversations with folks and to invite them to be a part of the efforts, and then to also allow them the opportunity to have voice and presence in those initiatives is so important too, because it's not truly collaborative if there's just one captain steering the ship. So we want to make sure that we're looking at that, like Susie said, building connectedness across issues and also across the folks who are involved. I don't know, Susie, if you had anything to add to that.
I would just echo everything that Jody just said, and really when we're talking about, the one thing that I would say is to always remember that when we're talking about assisting vulnerable populations, to really find ways to empower their voices in as change agents and direction setters. And doing that through, I think, data are our friend, and remembering the importance of qualitative and storytelling data in all of our work to foster that connectedness. And those are the things that I would add, and just thank you all for the opportunity to talk about this.
Great. I love the ending on remember community voice and include community voice as part of your data sources too. So I think that was a great addition. So I really appreciate both of our guests today, well, all three, I meant both sets of guests today, for really being able to illuminate economic opportunity, both from the standpoint of wage gaps and increasing economic security, and then also from the standpoint of workplace policies and creating workplace cultures that can prevent violence. So thank you so much to all three of you. And to end us off, I'd love to share some tools and resources. We have Standing Firm's website that you can check out, standingfirmswpa.com. There's also the cost calculator that was mentioned earlier. Pat mentioned this one that can actually give you some more numbers and things that may speak to employers. Anything to add here, Pat, about this?
No, you'll see when you pull that up that the number that comes up with here is definitely an underestimate of the total cost, and we explain why, but it's pretty easy to use, and I encourage people to try it out.
And then there's also workplacesrespond.org that has a bunch of resources that have to do with workplace climate. And then, of course, you can check out the websites for the Wyoming Coalition Against Domestic Violence and Sexual Assault and the Wyoming Health Council. And our partners in Wyoming also recommended checking out this resource. Jody, do you want to explain this?
So I have recently become aware of this resource, Change the Story Vermont, and I don't have a ton of information to share on it because it was just newly introduced to me. However, when I went to the website and just spent a little bit of time, I thought, I have to check this out. This looks so good because it really is looking at improving women's economic status in Vermont, and it's an initiative that it looks like it's pretty mature. And so we will definitely be utilizing this or looking for ways that we can utilize this in Wyoming to help inform our work as well. We know that we're not the only ones doing work or looking to do good work, so we always are asking for input from other folks too. So if there's also anyone on the webinar today who is aware of other really good resources or information that you would love to share, or maybe you're involved with something, we would love to hear from you as well. So just going to put that
Yeah, I think those of us at Prevention Institute and Prevent Connect would also love to see what resources you have to share. And the last resource that I wanted to mention was, or is, our summary of the 2016 web conference series called Expanding Partnerships and Linkages, Key Directions in Sexual and Domestic Violence Prevention. So what we actually did is summarize all the web conferences from the 2016 series that instead of having to listen to audio recordings of all of them, you can go and get some of those key messages and resources pulled out. So definitely recommend you checking that out too. And that concludes our web conference today. Meghna, do you have anything to add?
Yeah, absolutely. Thanks, Alicia. So this is Meghna here, and on behalf of Prevent Connect, thank you once again for joining us today, especially our presenters for sharing your insights and work experience, and also to our fabulous team of colleagues at Prevention Institute. We definitely encourage you to join us for the next session, and have a wonderful Wednesday.
Thank you, everyone. Bye.